What is the recommended course of action if a patient feels faint during a blood draw? So option A says to instruct the patient to take deep breath into a paper bag. And in some situations, this is used, like if a patient is hyperventilating, if they're having a panic attack, it helps to regulate the breathing and prevent any acid-base imbalance, because if they're breathing very fast, then it's hard to coordinate the oxygen and CO2 exchange. However, it's just saying that the patient feels faint. It's not saying that they're hyperventilating, and there are other choices here that are better options for this type of situation, like feeling faint during a blood draw. So we can eliminate option A, and let's see the other choices. Option B says to continue the blood draw and reassure the patient. So reassuring the patient is okay, but you shouldn't continue with something if a patient has a reaction. Just as a rule in general, if you're doing any sort of procedure, if a patient has some sort of reaction, whether it be pain, feeling faint, like in this example, or having a rash, any sort of reaction, you always want to stop it. We wouldn't want to continue it. So we should eliminate option B. Option C says lay the patient flat on the exam table and elevate the legs. And maybe this is something that we'll consider. So let's compare option C to option D here. Option D here says to stop the blood draw. And absolutely, like we were saying, we want to stop anything that's causing some sort of reaction for the patient. So that's great. And then with that, we want to remove the needle and the tourniquet. We don't want to leave that in them. And then leaving the tourniquet would cut off circulation. So we want to remove that. That's good. Position the patient in a sitting position with their head lowered between their knees. And this is a type of position that is helpful for a patient who feels faint, because by positioning the head lower than the heart, that is helpful for circulating the blood and then getting them back to proper feeling and proper position. So option D looks good. And that would be a good first step. Option C is maybe another second option, because if the patient is feeling faint, you wouldn't want them to be in a position where they could potentially fall over. You would want them to be laying down. But the initial getting the circulation back going here, the sitting position, the head lowered, also stopping the transfusion, option D is a very good first step. So first. And then if that still isn't working, if there's any fear that they could potentially fall, option C is also putting them in a safe position, but option D is just more helpful to actually fixing the problem at hand here, which is the feeling faint here and wanting to stop the blood draw to prevent any sort of fainting from happening, and then treating it here with this position. And then option C would probably be the next best option if you were just strictly focusing on just keeping the patient safe. But option D is actually keeping the patient safe while actually treating best what's going on. So we will go with option D for this situation.